Dr. Gold, we've talked in great lengths with many videos about, LASIK surgery, in fact, EPI Lasik surgery, which doesn't do any cutting anymore, and it's very new, and it kind of like prevents, when a person had normal LASIK surgery, what people don't know, there's a little flap in the eye. Whichever way we imagine that flap, it's probably not quite the way we imagine it, but whatever it is, there's something in the eye, and that particular flap cannot heal quite ever. And that information is rather new, and because it cannot heal, if the person ever gets poked in the eye, that's never a good thing. But once have that LASIK surgery, there could be a vision loss problem. And with the new surgery, the EPI surgery, that's not the case anymore. Tell us this again a little bit more, like the impact of that for the patient.
Well, EPI Lasik is a great deal safer because it's performed without cutting a flap into the cornea. The cornea has 5 layers, and with LASIK surgery, a flap is cut across the cornea in the 3rd layer down, and then the laser portion of the procedure is done deep in the inner half of the 3rd layer down of the cornea. In EPI Lasik, all that's done is the surface cells, the layer number 1, is removed similar to a snowplow removing the snow from your driveway. And that exposes the 2nd layer down, which is much more superficial, and the laser vision change is made in the 2nd layer down. And then over the next 3 days, the surface cells heal, and the vision during those 3 days is quite functional, but it's really good by the end of that 3rd day, without the risk of later on in life getting poked in the eye and having the flap come loose. So it's drastically safer.
Right. So for a layman like me, I see 2 things here. Number 1, you're not cutting, which it's just not a pleasant thought to be cut, even on a small thing like a pencil or a meniscus operation. Cutting is cutting, and if it's cutting in the eye, so no cutting, number 1. Number 2, the way I put it, and correct me if this is a very wrong analogy, for all purpose, the normal LASIK surgery simply is kind of not 100% finished. You're almost living an open wound there constantly, ready to be exposed, by being punched or poked in the eye. It's just simply, it's almost like walking away from appendix operation and saying, there's that last 3 millimeter. We're not going to sew it up. We just leave it like that. And as long as that the guy is not a boxer and nobody punches him in, it will be fine. Is something like that, or leave a little a mine, like the mine they have in wars, where you step on it and you explode. Leave a little mine in there, in that eye, and say, well, we're not taking it out. And then nothing hopefully will happen because we don't get poked that often in the eye. But there is that little part from that operation which simply never cured and is open to be exploding one way or the other way, maybe. Yes or no?
Well, the surface cells around the edges of the flap, the surface cells actually do heal.
Okay.
The difference is that where the flap is raised, the interface between those 2 surfaces is what never heals.
Right.
So the edges heal, but the bed of the cornea, from the back surface of the flap to the front of the bed, that's what never heals.
Yeah.
So it's not really an open wound. But it's an area that doesn't heal, so it's subject to serious trauma with a blow to the eye.
Right. So it's not an open wound like the appendix operation example, but it's inside, and there's something inside. The wound is healed over it, otherwise it would rin all out and whatever. But there is something inside which is kind of like, as I said, like a landmine. There it is sitting, ready to be activated. Even though you said you have done 10,000 of those surgeries, even in the old days when when this new way wasn't available, and only 4 or 5 people had something like that happening. It's extremely low. As I said, we take care of it. We don't try to be, being poked in the eye too much. It could never be good. But it does happen, and it's good. So basically, if something is done, it's wonderful. All right. Anything else that if it is EPI Lasik surgery, because of this healing and stuff, does a person see slightly better or not so good, or is that relatively the same as long as nothing happens afterwards?
Hypothetically, the quality of the vision with EPI Lasik should be better, because all we have to do is get that surface layer to heal smooth, and that's a real piece of cake. Whereas with LASIK, we have to have perfect union at that interface, which never really heals. So theoretically, the vision should have a higher quality with EPI Lasik. But in practical terms, they're probably equal.
Right. It's probably difficult to really measure, because whoever had a normal LASIK surgery didn't have the other one. Who had an EPI Lasik surgery didn't have the other one. So it's difficult to say which one you like better. It's not like a wedding dress. You try this one on, you try that one on, and say I like that one better, right?
Right. Yeah. I like your analogies.
Oh, wonderful. Thank you very much.